Standing windmill. In the standing windmill position, we're going to use the wall as our guide. She's going to scoot back, touching her heels to the wall. She wants to be her toes pointing straight, hip width apart. And so we have a nice kinetic chain between the ankle, the hip, and the shoulder. So her load joints are positioned on top of each other. She's going to bring her arms up to where her wrists are level with her shoulders. And so the most important thing at this point is to keep the pelvis locked into the wall. And so we don't want the pelvis to rotate off the wall, or we don't want the pelvis to shift. So at this point, this is completely isolated, like you had two big screws screwing you into the wall. Her ear in this position, the vertical load line is established. So her ear's over her shoulder, over her hip, over her knee, and over her ankle. So her arms and her cervical spine are just an extension of the thoracic spine at this point. They don't move independently. They're just going to follow her thoracic spine. So she's going to laterally flex to the right, only going down as far as she can without this pelvis moving at all. So it shouldn't rotate or slide. She's going to come back up to the top and pause for a second before she goes to the opposite side. And then come back up and pause. As you increase your flexibility through lateral flexion of the trunk, you can increase that range of motion and go a little bit deeper into it. Just make sure if your pelvis starts to move, you're going a little too far. After she does 5 each side, or whatever your therapist has prescribed, she's going to come back up to the top. She's going to go wider in her stance. And then she's going to reestablish the pelvis to the wall, making sure it doesn't move, and then go to the right. Laterally flex as far as possible, really lengthening these para-spinal muscles. Coming back up and to the other side. Pelvis isn't moving, fantastic. Come back up, pause, repeat as your therapist prescribes, and then go wider in your stance. And then again, after you go wider, you have to reestablish the pelvis to the wall, making sure it's not rotated off the wall or move. And go ahead and laterally flex to the right. Back up to center. And so her head is moving with her spine. It's not moving by itself or independently, or the shoulders, so she's doing a great job. Back up to center. Repeat as your therapist has prescribed, and this is standing windmill.